Hi guys, Jake with Chandler Physical Therapy. I recently wrote a blog on dizziness, so today we're going to talk about what's called BPPV, or it's called benign paroxsysmal positional vertigo. Basically, it means you've got these little crystals in your ears, and somehow, one way or another, they get a little bit dislodged and they make you dizzy. What's great about it is it's benign, meaning it's not malignant, it's not anything inherently dangerous, other than the fact that it makes you super dizzy. So most common complaints are, I'm sitting up in bed and I get dizzy for 10 to 60 seconds, that sort of thing, or I'm rotating my head while I'm driving and I get a little bit dizzy, maybe look up at the ceiling, that sort of thing. Usually lasts 10 to 60 seconds, makes you feel maybe like the room is spinning, things like that. So basically what happens in the inner ear, you have these crystals that are supposed to be in one area and they end up being dislodged into a different area. So it's a mechanical problem, it has a mechanical fix. The fix basically is to take the head, move it into a couple different positions to relocate those crystals where they need to be, and then you're feeling great a couple days, maybe a day or two later, that sort of thing. Usually the rest of the day, sometimes it feels like you're a little bit lightheaded or a little bit woozy after the maneuver, but it has a very, very good success rate as far as about 98% successful the first time, okay? So I'm going to show you the maneuver here real quick. We'll take Yuvia through it. She doesn't have any dizziness currently, but this is what the maneuver looks like. So we're going to turn your head just like this. We're going to drop her back onto her right shoulder. As we do it, hold on one sec. As we do it, she might feel a little bit dizzy. It'll be the similar thing as when you're sitting up in bed and you get dizzy, though. It'll last about 10 to 60 seconds and then it'll go away. So we're going to lay back on 3. Ready? 1, 2, 3. So assuming we have the right canal, we're going to hang out here for about 30, 60 seconds, maybe 2 minutes, depending on how long symptoms last for you. She might feel a little bit dizzy, but I'm going to hang out with her, make sure that she doesn't fall off the table. At a certain point, she's going to say, okay, I feel a little bit better. Things have relatively gone away. At that point, we're going to sit up. We're going all the way over onto the other side. Forehead's pointed right down towards the table. At this point, we're shifting those crystals around again. She might say, I feel a little dizzy again. That's okay. That's what we want, because now we're moving those crystals to where they need to go. After about 30 seconds, 2 minutes, somewhere in that range, when symptoms subside again, we're going to sit straight up. Those crystals are allowed to relatively drop where they need to go. She's going to say, maybe I feel a little bit of residual. We're going to recheck everything. Everything should be slightly reduced. And then we're going to kind of recheck the next day. The next day should be doing pretty well. We've got those crystals back where they need to be, and you're back to doing everything that you want to do without dizziness. That's a real quick fix. So come stop by Chandler Physical Therapy and we'll give you a full dizziness evaluation, find out what's going on. And if it's BPPV, has a very quick fix and you're back to doing everything you want to do.